I started having trouble remembering names of patients and names of things as I was talking. And it's interesting how mold can affect parts of the brain and not others, because I couldn't remember a patient's name, but I could still do the differential diagnosis and all the thinking through the issues. But I knew there was something going on. And then one day I remember walking up the stairs to my second floor office, and I was carrying on a conversation with a patient, and I felt so short of breath I couldn't keep talking. And I'm like, what in the world is going on here?
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Welcome, everyone. My name is Jen Rivas. I'm here with my amazing co-host, Dr. Emmy Brown. Dr. Emmy, how you doing today?
I'm doing great. How are you, Jen?
Awesome. I could not be more excited because today we are honored to be joined by Dr. Jill Carnahan, a renowned physician, speaker, and author who is widely recognized for her expertise in functional and integrative medicine. Dr. Jill has dedicated her career to helping patients overcome complex health challenges, including autoimmune diseases, chronic fatigue syndrome, and environmental toxicity, just to name a few. Her groundbreaking research and compassionate approach to patient care have earned her a reputation as a trailblazer in the field of holistic medicine. We cannot wait to dive in and also explore her latest book, Unexpected, which is raw and vulnerable and explores the connection between trauma, stress, and chronic illness while offering a roadmap to healing. So let's welcome Dr. Jill Carnahan.
Thank you, Jen. I'm so excited to be here with you guys.
As are we.
All right. Hi, Dr. Jill. It's so nice to meet you. Thank you for being here with us today. I'm going to kick it off, and we really want to start with mold illness because oftentimes it can really disrupt the immune system and lead to a cascade of other issues. Personally, I shied away from treating toxic mold in practice because it can be very demanding, as you know, all time consuming practice. It requires training even beyond my naturopathic medical curriculum. But more and more practitioners are diving in because they're realizing mold illness should be on their list of differential diagnoses for their complex cases. And I know that you have personal experience with toxic mold illness. Would you mind starting off with telling us how that looked like for you and how you managed it?
Sure. I so get that sentiment, Emmy, because I was the one like, I'm not doing Lyme, I'm not doing mold, I'm just going to stick to the gut. But what happens is if you really care about healing patients and you're a true healer, which you clearly are, and I think in my heart I am too, you have to go where the chronic illness takes us. And with our complex chronic landscape, before I go into mold, I want to frame this because I think it's real important for framing.
Yes.
And I think of functional medicine as really toxic load plus infectious burden. And at the core, these things drive immune dysfunction, autoimmunity, neuroinflammation. And the three things we see most with the toxic load issues are cancer, autoimmune disease, and chronic neuroinflammatory diseases. And again, these can present so many different landscapes. But when we frame it that way, we realize we have to go there. We have to go. And what we're finding out now is 1 in 20, it's 24%, about 1 in 4 homes or workplaces are affected by toxic mold. And sadly, there's a higher percentage of government buildings and schools and courthouses and all kinds of things where people are spending time and even again, our children in our schools. So it's really, really common. And what happened in the 70s is they started putting fungicides in paints because they thought, oh, if we put antifungals, anti-mold in the paint, then we won't have any mold in the homes. But just like antibiotic drug resistance and creating superorganisms, this created the kinds of molds that grow indoors now are not your grandmother's molds. There's a lot of people ask, well, you know what? Mildew in my grandmother's shower, it wasn't that big a deal. Well, the types of molds now that are growing indoors are much more aggressive and they're producing higher levels of toxic mycotoxins, which can damage the brain and nervous system and the lungs and all the systems really. So all that to say, it is a bigger issue. And that's why we're seeing more of it. And then we have quick material fabrication. A lot of the materials we use are porous. So they love mold like drywall. And it's basically like building houses out of more cardboard versus sticks and stones and things. But the materials we use and then the fast construction. And if there's damp or moisture that gets into the materials, or say a lumberyard has wood sitting out and it gets rained on or snowed on, and then you use that lumber that's been moisturized and has some potential mold growing on it, you build a home with it. And all these kinds of materials and the practices of labor, the quick construction, the less quality materials are really creating a bigger problem. And many of the houses that I see that are damaged by mold are not old. They're new. They're new construction. So it's also a misnomer to think, oh, if I have a new house, if I have a multi-million-dollar house, it's not affected. Sadly, mold is not it's not respecter of these environments. It'll go anywhere. So it's a bigger problem than ever before. And like I said, it's a driver of complex chronic illness. And what we're seeing now is epidemics of mold related illness, and people don't even know. So often they'll present with brain fog, chronic fatigue, migraine headaches, mast cell activation issues, or even because the mold weakens the immune system, we'll see old infections that pop up. All of a sudden, someone has symptoms of Lyme where they have joint pain and fatigue and they never had it before. And I always think of it as because mold is weakening that immune system, old infections like the chickenpox that you got at 5 years old pops up as shingles. The Epstein-Barr that you got at 19 in college in your dormitory for mononucleosis pops up as chronic fatigue. Or the Lyme disease, you got bit when you were 12 hiking with your family. The Lyme disease was under control because your immune system was robust. And that mold weakening your immune system, all of a sudden you start to have migratory joint pain and brain fog and fatigue. So it masquerades, but it plays its way into so many chronic and complex illnesses.
Geez, yeah, and you really put that into context in so many easy to understand ways. And really, why is it becoming more of an issue? And you explain it. Even new building materials, I don't think people realize that. And the fungicides in the paint, that's news to me. So
Yeah,
it's really, really kind of
that's eye
stunning.
opening. Wow.
Absolutely. Yeah. So, yeah, I'd love to know kind of what was your experience like with mold illness? How did it present for you? How did you tackle it? I'm sure that whenever we experience something as practitioners, it really sticks with us and we're able to help patients after that, after going through it ourselves. So, I'd love to hear more about that if you don't mind.
Yeah, so I didn't know this when I was born, but my journey as a healer is experiential. And I had cancer at 25 and then Crohn's at 26 and went through that was in medical school. And then I was doing pretty well. I got through the cancer, the Crohn's, my hair started to grow back and got through medical school, went through residency in family medicine. And then I moved to Boulder in 2010 to start my own functional practice. And life was pretty good. I was hiking and skiing and enjoying life and active and healthy. And I thought all that illness was behind me. But 2013, we had a massive flood in Boulder. We've now had these natural disasters. In fact, a few weeks before or actually just last week, as we're recording, there's a huge flood in Fort Lauderdale. And these things are just happening more and more. So natural disasters are creating, and fires are another thing, but all these things create more issues with flooding. And when there's flooding, there's water damage, and this water seeps into these basements and porous materials. And in 2013, Boulder happened to have a massive, massive flood, literally billions of dollars of damage and homes destroyed and people, dealing with this. And I did not think a lot of it. In fact, it was my staff always joked that one day it was raining and it kept raining and raining and raining and raining. And there was some flash flood warnings in the beginning. And I think a lot of my staff ended up staying home. They couldn't get to work. I was in the office seeing patients on the day of the flood. Just that's what I do, right? I go to work. But all that to say, we didn't really know the sequelae. The sequelae was massive mold growth. And my building, my office building, was an older 1970s building. And it had a basement and then a main level. And I was on the second level. And the basement was already had some mold growth, didn't know this. And the water seeped in there and created more issues there. And then there was a crawl space right under my office on that first floor, unfinished. And there was standing water in the crawl space. Again, had no idea about these kinds of things. And then my office was a remodeled office where there was an old 1970s carpet. And my contractor had the brilliant idea to put beautiful bamboo new floors on top of that carpet. And now I look back and like, it was under that mold, that carpet probably already had a little bit of mold. And then the flood came and made everything thousands of times worse. And again, I didn't know it. All I knew was the year after I started having rashes. I had a weak immune system. I would get colds. I would get sick easily. I started having trouble remembering names of patients and names of things as I was talking. And it's interesting how mold can affect parts of the brain and not others, because I couldn't remember a patient's name, but I could still do the differential diagnosis and all the thinking through the issues. But I knew there was something going on. And then one day I remember walking up the stairs to my second floor office and I was carrying on a conversation with a patient and I felt so short of breath, I couldn't keep talking. And I'm like, what in the world is going on here? And as is so common with mold related illness, I was in a bit of denial because I had the suspicion that there might be some chemical or toxin or mold in my environment affecting my brain and my immune system. But the idea that the mold could be in my office, maybe at my home, who knows where it was a little overwhelming. And I have such compassion as us as physicians. You guys know how this goes. When you're talking to a patient, you see all the data and you think there might be mold. And you start to address it. You say, do you think there's mold in your house? Or have you ever had water damage? Or have you ever had a dishwasher leak or a fridge water line break or signs of water damage under your sinks or your washer dryer? There's so many places, your sump pump overflowing, and you can start to talk through these things. Any sign of condensation through your foundation, any leakage in your windows from, water damage coming in or they're not sealed properly or condensation there. Is your attic and crawl space? And I'm actually saying all these things because if you're listening and you wonder where this could go wrong, you can think through that in your own house. But you're asking these things to the patient, and the patient's like, no, 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 I'm fine. Or we had an inspection, we thought there might be mold, but the inspector said it's perfect, right? Because it had one air sample or some simple thing. And they said everything's fine. But you as a clinician know, gosh, there's a lot of signs and symptoms of mold. And all the way back to my initial thing, that I have a lot of compassion because many patients are in denial because it's really overwhelming to think about this safe home that we create. It's our place of sanctuary where we sleep, we rest, restore. And what if there's toxic mold? Well, that means I either need to remediate or move or do something. And it's probably going to cost a lot of money. And I was no different in the beginning. I thought, oh no, if this is mold, what am I going to do? Well, it got so bad to where I could barely function. I mean, I was really starting to go downhill. And I remember getting an inspector in the building of my office, going down to the basement. And that was back in the day. I had no idea of personal protective gear. I'm like, no mask in my work clothes, pulling at toxic black mold and taking samples. Like, it's crazy looking back at that, right? Like, now I know better. I would have never gone down there and be like, no protection at all. And again, that was shame on the inspector. He should have been doing it too. But anyway, learned a lot. The bulk samples came back with Stachybotrys, which is an absolutely toxic black mold, weakens the immune system. And within that same week, I got a urine sample back that showed trichocythanes in my urine. So that was a match. It was like, okay, this is the issue. And I literally got that urine result and that sample within the same week. It was around Christmas 2014. I did not set foot in my office after that. Like, no, I didn't even go back. And I had a whole office full of beautiful furniture. I had books, a library of books from medical school. And I gave all of that up for my health because not everybody has to do that. I want to be clear. You don't have to leave everything. But in my case, it was so clear intuitively that I couldn't take all those things with me. And it was so worth my health to walk away from that and to start over. So I was in my home for doing patients remotely for a month or two till I found new space. And then we were in one of these cubicle offices as a medical office just to get by until we built a new space. And it was quite an ordeal. But I really feel like that choice for me in that building to walk away was part of the reason it saved my life and that I can function now.
Yeah. Wow.
Amazing. And I know we're on a podcast, we're doing this live, but I've actually seen Dr. Jill speak live and I've seen those pictures, Dr. Jill, and it was moving. I mean, it was a moving story. So kudos to you for taking your health that seriously. And it is hard. It absolutely is hard, but wow.
Thank you.
Incredible.
Yeah, it's funny because I look well now and my eyes are clear and skin's okay, but you saw those photos back in the day. I mean, I remember sitting in the car one time and I was going to go into church or some meeting or something. And I pulled down the visor and my eyes were so red and swollen and cracked. My skin was full of breakouts and acne because C4A, which is one of the complement slip products that goes up with mold exposure, can cause cystic acne. I had that and my face was hideous. And I remember just weeping and crying because as physicians, we think we have to have all the answers and we should have all the answers, especially when it comes to our own health or those closest to us, like family members. And just speaking, if you're out there listening as a clinician, this is a very real thing. We're like, what is wrong with me if I can't heal myself? And I remember sitting there crying, like, I can't go in there. I'm supposed to be a healer. And look at me. I look horrible. I look like I have leprosy or something. And granted, I should have had a little more self-compassion. But I was so overwhelmed with that. Like, how in the world can I heal myself or look like this and be a healer? And I think I'm saying that because I know there's people who resonate out there with that idea because we don't have all the answers. And actually, part of the reason I wrote the book and I get out there and speak is giving people permission to be in the uncertainty. We think medicine is black and white. We think there's this answers, black and white. And the truth is it's all gray. And there's a lot of science and there's a lot of beautiful answers, but we're continually struggling through the fact that medicine, functional medicine, all that we do is inherently uncertain, right? Like there's a lot of uncertainty. And when we face that, it feels like we're failing or we're a failure. And the truth is, no, that's just part of our journey. And I want to give all of you listening permission to be yourselves and to be in that uncertainty because it's a scary place to be. We like to have answers, but the more we embrace that, the more we find the miracles and the more we find surprising answers to some of the most complex problems.
Absolutely. Thank you so much for saying that, Dr. Jill, because I don't think that practitioners talk about that. I mean, I don't think I've ever heard even a colleague or, a practitioner on a podcast like this mention that it's part of the journey to go through something yourself, even if there's outward sign. And it's really helpful, I think, for clinicians to hear that. So thank you so much for that. And I'm wondering, you mentioned a couple different things in terms of presentation. And what do you see at this point now that you feel you went through it yourself, you've treated toxic mold illness? What is a classic presentation if you could paint that first? I know there's so many overlapping signs and symptoms. There's a huge differential when we're considering mold illness, but what would be for you a classic presentation if it was to if someone was to walk into your office and you'd say this is the top of my list if kind of other stuff had been rolled out at that point?
Yeah, that's actually a great question. So timeline is crucial. And of course, functional medicine practitioners are good at getting timelines. But I often ask, when did you last feel well? When was the last time you really felt great? And they'll give me, maybe 2008 or 2017 or whatever number year. And then we talk about what happened since then. And the changes in environment are a big clue to some external environmental toxin creating illness. And granted, it could be mold, but it could also be a natural gas leak, or it could be a of wildfire in your neighborhood that released all kinds of metals and burning materials and things. There's all multiple things that could it be. But then as we hone in, well, ever since I moved to Denver in 2010, I haven't felt well. And it started maybe 9 months after I moved to the house. It isn't always immediate. Just like the flood for me, it was 2013. It was a year later when I was really in the throes of being ill because it took some time for that water damage and that issue. And a couple things could happen. Either you have a story where you moved to a new place and that new place already had some issues with mold. You didn't know it. You moved in and you started to feel unwell, or you smelt a musty smell, or you had a water leak or damage. Or you could have moved into a home, been in a home, and then all of a sudden one time there was a flood, there was a significant water leak. And I know how to ask. I am not a construction expert or an environmental expert, but I've learned those questions are crucial. So I know enough about house construction and water lines and where they are at, just like I mentioned earlier, all the types of things. And that was not even close to comprehensive because the more I know to ask the questions, almost no one will say, when you say, "Do you have mold in your house?" Everybody's going to say, "No, I'm fine. There's no mold in the house," right? They might even say, "Oh, there's a little musty smell, but there's no mold." Well, musty smell is the VOCs, the volatile organic compounds of mold. It's part of the evidence of mold. So if you're dealing with a musty smell, there is mold. And so, but if you ask the roundabout questions, well, have you ever had a sump pump overflow? Have you ever had foundational issues? Have you ever had all the things I went through before? And then they might say, "Oh, yeah, our fridge line leaks." Here's an example of me. I'm like the mold expert. I know these things. I take really good care of my condo, which I'm in recording right now. Last summer, my neighbor's fridge above me on the condo above me leaked. None of us knew it. Went down through the wall into my floor, and I started having some loose floor tiles and ended up pulling out the fridge. We found mold behind the fridge, Cotomium of all things, nasty black mold. And it wasn't because I didn't take care of the home or do the repair or whatever. It was because of my neighbor. So things that you have no control over. And that's one thing. I'll just give you a pearl here. I have disconnected the water line from my fridge, and I will never have a fridge with a water line ever again. It's just too risky. Now, you don't have to go to the extreme, but I'd rather have a pitcher or a reverse osmosis filter. And it's just not worth the filtered water to have that risk of a leak in your water line to your fridge. So all that to say, it's very subtle. And the history where you change environments. Another question I ask is, have you gone on vacation or been out of your home or been anywhere? And often we'll hear this story. Yeah, I went skiing for 2 weeks in Vail, or I was in Hawaii for a week. And I felt a lot better when I was away from my home. So these questions about the changes in your health related to environment. And then as far as symptoms, cognitive decline, word finding, focus, concentration, memory, assimilation of new knowledge, those are all really common. So if someone has a new onset ADD as an adult, someone has a new cognitive decline as an adult. Dale Bredesen's work on Alzheimer's, he will quote 1 in 3 early onset dementia is mold related. That's 33%. So the brain is number one. Other things, autoimmunity, new onset autoimmune disease is very common because mold will raise Th17, which is related to autoimmune disease, and TGF beta drives that. And we can actually measure these markers. And those things will often drive a new onset autoimmune disease. Immune dysfunction, where you're getting sick frequently. You have maybe chronic fungal infections or viral reactivation, that's common. And like I said earlier, even Lyme disease. Before I treat Lyme disease, I check for mold because I've seen maybe 1 out of 3 or 2 out of 3 times that person had Lyme disease. It was dormant. The immune system was keeping it under control. They get into a moldy environment, weakened immune system, and all of a sudden the old infections start to pop up and cause issues. But if you take care of the biotoxin illness, get the immune system back online, it's not such an issue. Some unique signs and symptoms that are pretty unique to mold: increased thirst, increased urination, or electrostatic shocks, which basically you can create a battery on your skin when you're sweating out the salt gradient and you go to doorknobs and things and create the static shock. Some patients have gone as far as to break electronics. They're on their computer and it just shuts down, or
Oh
their
my
watch
gosh.
stops working. And that's because of this literally shock. They're creating a human battery because they're dehydrated. Their ADH isn't working. They're drinking and they're peeing and they're not maintaining hydration. And then ice pick pains, these like sharp stabbing pains. They can be any part of the body, but a lot of people talk about these sharp pains in the head, neurological numbness, tingling. I could go on and on, but those are just some of the few that make me wonder and then look for mold.
Sure. Wow. And to be that specific in terms of the static electricity and the pathophysiology in terms of labs, I think that really helps providers get more specific. And if they're not ready to order those labs, I'm wondering, Dr. Jill, do you see anything on routine labs when they're coming in from their primary care doc? They did their annual exam. Do you see any signs that maybe would be considered normal by conventional standards? So high normals, low normals, and you say, based on what you're telling me, your history, the physical exam, do you ever suspect mold based on those more routine labs?
Yeah, so new onset adult acne, again, there could be many other causes like gut issues, but that, like I said, C4A will raise, complement will cause cystic acne. So that's especially someone struggling, the brain stuff on labs. So typically your comprehensive metabolic profile, your CBCs are pretty normal. Once in a while, we'll see elevated platelets for inflammation or low white blood count. Usually that's another infection that the mold has weakened the immune system, like
Right.
Epstein-Barr or Lyme will cause like a chronically leukopenia. But that's again more the infection, not just the mold. But inflammatory markers, if we're going a little deeper, the things I usually check now are TGF beta, MMP9, VEGF, and MSH. Those are the kind of four that out of all the Sears labs I've kind of come to find are so helpful. And what you'll see is elevated TGF beta, usually above 2380. The MMP9 will be above about 330. And that can be blood-brain barrier. So if you see out like 900 or 1200 MMP9, you're thinking blood-brain barrier is permeable, you need to address the
Mhm.
brain mold there. VEGF is related to capillary perfusion, so VEGF can go up in Bartonella as well, but if it's above like 20 or 30, I'm going from the top of my head, so these might not be exact, but they're close. But VEGF really high is indicating that those capillaries are not getting oxygenated. Long COVID can cause this too because often that'll increase viscosity or fibrin in the blood where you're not getting oxygenation. Bartonella can do this, so there's issues there. But mold can also do this, and VEGF can be really high because the tissues that cytokine storm from the mold will cause decreased capillary perfusion to the periphery, to the little tiny vessels in the fingers and toes and things. And then the cell signal is like, we need more blood vessels. Well, VEGF can be in cancer creating more blood vessels, but it can also be in non-cancer situations saying we need more oxygen. And then MSH is our melanocyte stimulating hormone from the hypothalamic pituitary axis. And it actually, surprisingly, of course, it regulates melatonin production. It regulates sleep-wake cycles. It can help regulate hydration because MSH and ADH are both in the posterior pituitary. So if one is off, they often will both be off. And sometimes we can see both MSH low and ADH low as well. And ADH is the thing that regulates our hydration. It's vasopressin, so it keeps the volume in our vascular system. If we don't have any ADH, we can drink and pee and drink and pee, and we're dehydrated, but there's no signal to maintain hydration. And then the unique thing about MSH is there's a correlation with inflammatory bowel disease and intestinal permeability. So if you have a very low MSH, you're going to likely have more intestinal permeability as well. Other things, if you check just ANA or immunoglobulins, sometimes you can see elevated autoimmune markers, anticardiolipin, anti-nuclear antibody, or other autoimmune signs. You might also see a low total IgG or a low total IgA, which is showing that weakened immune system. And gosh, there's more, but those are kind of some of the basics on that level of what you could be checking. But your typical CBC, CMP, TSH is probably not going to show a whole lot.
Right. And that's why we need to have those more in depth labs, more advanced labs, and looking for those patterns and everything you just said. I think it's a really good starting place for practitioners. It's a lot of technical information, but it's very helpful as a starting place. So
Mm.
I think we
And
can
of
take
course, mycotoxin. We've ignored the
right.
elephant in the room. I love your mycotoxin test with Vibra because this is so helpful because what you can do, none of these are diagnostic. And I think clinicians could get in trouble if they just exclusively use mycotoxin because what we're measuring is urine excretion. And if we're healthy and we've had some toxic exposure, whether it's your toxin panel or your mold, I don't know that I've had anyone with no exposures because that's our life, right? We're all swimming in toxic soup. And we all get mold exposure somewhere. We're inevitably guaranteed to walk into a building with mold at some point. So it would surprise me if someone had zero mycotoxins. But what you can do is put that in the framework of number one, they're excreting. So this is good. This is not all bad. Number two, do these match with the molds that are in their environment? I often try to match them up to say, is this likely to source your home or your workplace or whatever? And of course, if the levels are really high and they're the types like trichocythenes, that are really toxic from Catoma globosum or Stachybotrys, these are much more likely to cause immune issues. So I'm a huge fan of doing the blood work, but also the mycotoxin testing as well.
Right. Putting together all those pieces of the puzzle is really important. So thank you for pointing that out for everybody. Um, okay, I'm gonna hand it off to you, Jen, because I had the whole mold section and I could go all day on it, but I definitely want to switch gears and get a little bit more in and get around to talking about your book too.
Yes, we will get there for sure. I just want to first talk about how you might empower other practitioners, Dr. Jill. We obviously know when your patient presents, it's extremely overwhelming, like we talked about before. What suggestions do you have for not only bringing this awareness to the forefront with their patients, but also getting that compliance? What success have you seen? What tools and strategies do you use with your patients?
Yeah. So it's interesting. You mentioned the book. I think there's a framework there that is helpful. I talk about it's called Unexpected, Finding Resilience Through Functional Medicine, our foundation, science and faith. And the way we could frame that is also science intuition, right brain, left brain, masculine, feminine. Like there's all these parts of ourselves, right? And all of us, whether we're male or female, we have all of these parts. And I say this because our traditional medical training is very, very masculinized in nature. It's driven, it's science based, it's a to-do list, it's differentials. And this is great. This is a phenomenal analytical foundation of proving a differential diagnosis and where you're going. But if you stop there, and I'm saying this because the training that I had in Chicago at very conventional medical training, it really trained out the empathy, the intuition, the right brain creativity. And I'm bringing that back to the forefront because the true answers on these difficult, complex situations, we can take our left brain analytical computer, which I have done for years. I have bioengineering background. I have this very strong in me and it's powerful and it's helpful. But if we limit that, it's almost like an analog computer processing data, and we can do maybe thousands of pieces of data in a few minutes. When we go to the right brain, the intuition, the faith, this kind of deeper level of quantum healing and quantum knowing, it's that gut feeling that they've actually done science about with good experienced clinicians who have some experience in the clinical practice. They're knowing about what direction to go. It's not necessarily an analytical decision. It's a gut feeling is actually right on more times than the analytical mind. So it's
Mm.
powerful and it's accurate. But the thing is, you can't go to that gut feeling or that intuition in diagnosis unless you have some experience because your intuition literally relies on it's almost like going through a historical database of experiences and saying, what fits this model? What pattern have I seen that looks like this that appears today? Because every patient we see is different, but our pattern recognition system is part of the subconscious intuition. And I'm bringing this all up because this is not taught in conventional medical school. In fact, we're taught to never trust that, never believe that, never use it. And I had to relearn that because my intuition, that subconscious can process millions of pieces of data on my subconscious level, sights, sounds, smells, feelings in nanoseconds and can come to sometimes a better conclusion or at least as good of a conclusion as a logical brain. And when we combine that with curiosity, the power of diagnosis and helping people to heal is unlimited. It truly is. And even if we go even a step further with like work like Joe Dispenza and the power of the brain to transform our health. And I think we need to bring these both in because there's science is great. I never want to throw out the science and the lab testing and all of that. But if we don't start to grow in our intuitive skills, and part of that, you said, what makes a difference? What makes a difference is you first when that patient walks in, you create a space that they feel completely accepted and loved. They feel safe. They feel heard. They feel like you are present with them. One of the most powerful healers is for me to sit there with them and just be present and listen and ask them questions and let them tell me. And when I'm using that intuition, often I'll ask a question. I don't even know where that came from, but I'll say, well, what about this? Or what happened when you were 8 years old? And these things that come out as they're feeling safe enough to tell us the most precious, private, privileged pieces of information. Those things will allow us to truly help to heal them. And sometimes it's the chemical exposure, it's the mold in their environment, it's the tick-borne infection. But sometimes
Mm.
it's you listening to them and giving them space to say, you are worthy. You are unconditionally loved. Your body has the potential to heal. And sometimes it's those pieces that are the most powerful healers because that patient and doctor relationship is sacred. And when we treat it as such and we become present with them, that energy alone is the start of some of the miracles that we see in healing.
I love that. It actually gave me goosebumps because I that's just not what you see in today's typical conventional hospitals. You feel more like a number. Nobody's sitting down and really taking that time for you. So thank you for that. And I think that is a beautiful segue into more of a deeper dive into your book, Unexpected. You share several stories and how you ignored the clear signs that your body was giving you. And as a result, you suffered the consequences. Would you mind maybe sharing with the audience one of those stories and how we can be better stewards, of those signs that our body's trying to give us?
Yeah. So, and this kind of relates to what we were just talking about. I was in a farm environment, tough, strong German Swiss, analytical by nature. And again, that's a skill that's wonderful. And I know a lot of doctors have that, and we don't want to negate that. But what happens is we tend to live from our neck up. I said before the age of 40, I kind of lived in here and I used my mind to cope with trauma and difficulty and suffering. And then when I went down into the heart space and actually started to feel my body, and it segues into your question because your question was about I really ignored a lot of signs and symptoms. Like in medical school, there was things before my cancer diagnosis that were not right. I completely ignored them because I was so dissociated from the physical body. I was all in my head. And part of the healing for our patients as well, first of all, we have to embody this and practice it. And it's literally checking in, like, how does my it's interesting. I pause there because my thought was to medical school, it actually trains it out of us because what we're taught to do is not sleep, not eat, not use the restroom, stand and retract in a surgery for 6 to 8 hours, go 36-hour shifts without, and we're taught to deny our physical body's needs of eating, sleeping, drinking, using the restroom. And we're literally training ourselves to dissociate from our body. That makes a very non empathetic physician. So I had to relearn to reassociate with my body, my feelings, and those types of little things like, oh, there's a little pressure, my heart, my chest, not like a heart chest pain, but like heaviness. Oh, did someone upset me? Am I upset about something? What is creating that physical sensation? Or there's this feeling of overwhelm, my heart's fluttering, or my stomach is a little upset. I had this really difficult conversation with a neighbor. And those things, if we touch base with our physical symptoms, we can actually be kind to ourselves and nourish that part of ourselves so that we can have healing. If we are dissociated from our body, we're not able to even be there for our patients because we have to kind of know ourselves in order to know them. And then we can teach our patients to do the same. And so much of trauma, and again, this is the popular word right now, but it's really true. Whether it's big T trauma, you had, child abuse or an auto accident, or some of these are, you were a veteran in the war. Those are huge things. But you can have small T trauma where in your family you didn't feel seen or heard, or you had a great parents, but they didn't know how to nurture you, and those kinds of things are, if we can teach our patients to re in touch with their body and start to repair themselves and be kind to themselves, that's a huge part of healing, especially in the realm of one of the biggest epidemics that's about to hit us, and that's autoimmune disease. Because autoimmune disease by nature is attack of self. So, on a metaphorical level, there's some usually parts of ourselves we're not accepting, or attack of ourselves, or pieces that we need to heal in order to overcome that autoimmunity.
Wow. And that kind of ties into, correct me if I'm wrong, when you talk about intuition, tapping into that, sort of that role of that faith and spirituality that you also talk about in your book. Can you tell us more about like how do you use that with your patients, or do you use that? Do you tie that into your methodologies?
Yeah, so this is something that isn't talked about. Even my publisher warned me against using it on the cover. But I want to frame this. I definitely have a strong belief in a higher power, and that's my faith. But it doesn't have to be you as a listener. You could have you could be agnostic, atheist, or have a different belief than me. And the truth is, at the core, the commonality is this belief in something greater than ourselves, that there is purpose and meaning no matter what the circumstances. And if we have this framework, what happens is it's a way that we can deal with the inevitable uncertainty of life. Like life's going to throw us curveballs. We all know this from experience, but somehow we think we have control. We go out and buy insurance policies because then we'll be protected in case of emergency. It's this illusion that we have control over our own health, right? We're like, oh, I'm healthy. I eat right. I do all the right things. I, in high school, was voted by my senior class most health conscious, least likely to get ill. And
Ugh.
I was one at 25 that got cancer. Like in high school, I was eating well and I was running. I was doing I was practicing the things that should protect me against disease. But this inevitable uncertainty of life threw me a curveball, breast cancer, 25 years old. That's life. And it's not just for me. We all have a story. We all have the uncertainty curveballs getting thrown at us. And if we don't have some sort of foundation, whatever that is for you, belief in a higher purpose, we can take, if we don't, we're like, oh, this sucks. Life sucks. I hate life. This is going to, oh, but if we reframe it and we're like, oh, this is terrible. I would never wish this on my, worst enemy. I don't like going through breast cancer. I don't like going through financial difficulty, divorce, whatever you're going through. But if we have a frame, and the frame for me is faith, the frame is, I believe always there's something beautiful, even in the suffering, in the tragedy. And some of my mentors are beautiful people that have suffered far more than me, Viktor Frankl or Edith Eger. These are Holocaust victims that have suffered far more than I can ever imagine. And yet they kept their faith, their belief in the goodness of humanity and the belief that there was a greater purpose. They were out there loving people while they were about to die and suffering so greatly. And if we can reframe our life in that way, then nothing takes us off guard because we're expecting uncertainty. And we know that we have the roots and the foundation to deal with it, even if it's hard in the midst of it.
Beautiful answer. Thank you.
So inspiring, and the way you blend the art with the science of medicine, it's really very, very inspiring, and it makes me wonder. We talk about personal attitude and faith, but you also mentioned relational toxicity. So part of that faith and that inner knowing, that there is a light at the end of the tunnel, I think has a lot to do with our personal relationships.
Mm.
And we're such social beings. We talk about that physical toxicity as, in terms of mold illness, but this relational toxicity, what does that mean to you? How can it play out? Why do people find it so difficult to create boundaries?
Oh, I love this because I was one of those that, thought everything was great. I was in just about 20-year marriage and wonderful marriage. I would have told you right up until the day my husband walked in and told me he wanted, to not be with me anymore. I would have told you right up until that day I had a great marriage, but that was an illusion. I was in this happy bubble, this optimistic Pollyanna Jill bubble, and boom, it came crashing down. But what happened after that? Couple things. First of all, 2015, I wrote in my journal, next year, which would have been 2016, I'm going to write and publish my book about my story, right? That came before my divorce and some of these really difficult relationships. And the divine knew I had a lot more lessons to learn. And it ended up being quite a few more years. 2023, this year is when it's been published. But what happened in that is I always thought environmental toxicity was a big deal. I wanted to write about how the mold, the environment, the chemicals affect our health. But my next lesson that I didn't even know that needed to go in the book was this, what you're mentioning. And it's childhood trauma, relational toxicity, and how these things actually can be just as big of a toxic effect. So again, my marriage was not toxic, but it ended abruptly, unexpectedly, completely blew me out of the water. My sense of identity, I never thought I would be divorced at, 40 years old. And so all of a sudden I had to deal with who am I? And then I had to start dating. And I picked some really, really not such good characters. But I saw in myself, here I'm a successful practicing woman with a business and a clinic. But in the relationship aspect, I was so not healthy. And I was an empath who was attracting narcissists. My first experience was dating an ex LAPD FBI, very aggressive, kind of abusive man. When I finally realized it was abuse, I didn't even know what it was. And I filed a restraining order. And 2 days after I filed the restraining order, he was found dead of an overdose in his apartment. So, I mean, that was my first awakening to dating. That was my first relationship. And then the second one, I dated an ex-felon. He fitted 18 of the 20 criteria for psychopathy. Like looking back, this was not healthy either. He wasn't physically abusive, but he was emotionally abusive. But all that, like I told you in the beginning, I have to experience these things. And what happened in both of those things is I really understood at the core level what women like me, and I'm not unique. I'm sure there's other listeners that are like, I've got everything together, but my dating life is not so great. And part of this is learning, how are we attracting people? Do we believe we're worthy of healthy love? Do we understand what does emotional abuse look like? What does physical abuse look like? And are we actually the empath that's attracting the narcissist? And do we understand those patterns? And those are relational toxicity. And I think those things, or maybe we stay in a relationship that we know really isn't good for us, but it's secure or it's safe or we're afraid to leave. And I think those things, talking to women and men like me that are suffering from that, that's not talked about as us physicians. We have it all together, right? But we don't. And I don't. And so I put it all out there in the book of like, what did I learn in this situation and how can it apply to many other women and men out there like me that are maybe not making the best choices because they haven't dealt with this inner child that needs love and tenderness and compassion. And we can only truly show up in a good relationship if we trust ourselves. Like I knew from day one on both of those relationships intuitively, there's something off. I ignored my intuition because I wanted love and I didn't believe I was worthy of healthy love. And until I healed that little 5-year-old girl that thought she wasn't good enough and that didn't trust herself, then I could start dating healthy. But until I healed that little girl wound, I could not pick healthy relationships.
Mm. And how did you find the best way to connect with that intuition was and start listening to
Yeah.
that voice? I mean, I'm sure some people it's talk therapy, others it's grounding. But what really worked for you to say, I hear this intuition, but now I'm going to start listening and applying it?
Yeah, so it takes practice because what happens when we're living from our neck up and all in our head, we ignore our body's signals. And if I would have looked back, my body gave me signals, maybe like my heart was a little racy, or maybe just something felt off, just that feeling of feeling off. But you can't really go there until you do the somatic work. And you can pay therapists a lot of money, but some of this can start on your own. There's a great book by Bruce Perry called What Happened to Me. There's another book by Mark Wolin, It Didn't Start With You. And some of these books talk about like, how do you go into your body, start to feel the sensations and start to actually act on them and then get more confidence in your body's signals? Because if we're somewhat empathetic or intuitive, we can go into a party, right? And like maybe someone had an argument. We walk into there and we're like, we feel this energy. And you're like, oh, something's off. Or you go into this, like you're going out of a restaurant and there's a dark alley and you're like, oh, that doesn't feel right. I need to go this other direction to go around the building to get to my car. And I'm almost like just feeling it even right now, like our body knows, but we so often go in our mind and say, oh, that's stupid, Jill. That's being ridiculous. You're overreacting. You're in our society, especially for women, programs us to, oh, you're too emotional. Oh, you're overreacting. Oh, it's fine. And so because of that programming, we start to deny our own intuitive senses and move forward despite the warnings in our body. But my ability, if I can help patients do that or listeners or whatever, if we can reconnect, our body will tell us everything we need to know, but we've started to ignore it and we've become disconnected with it. So if we get back in connection, it takes some practice. We can really have this true, full information from our head and from our heart. And when that's working together, not only will that guide us as clinicians, but that will also heal us as human beings.
So practitioners and patients alike, everybody listening, we really need to tap into our bodies, listen, and again, meditation or breathing, really not ignoring. I mean, just the awareness. Don't ignore those signals. I think that's a really really important message. Um, all right. And I think we're talking about healthy mindset now. And of course, we're talking about this more intuitive based sense. So as a reminder, all the dietary modification, exercise, medication, supplementation, it might not make a difference if this stress persists, right? Do you have a favorite case wherein you helped a patient really turn the corner? Maybe they were doing all the right things in terms of compliance with the supplements and the exercise, etc. But they really made you saw a difference when they addressed that emotional toxicity.
Yeah, I've seen a couple cases and I'll give very brief vignettes. One was just a relationship someone was in, kind of similar to me, a marriage that had been very long, but they were just feeling this really difficult being themselves and being fully accepted. And in one case, she went on to really go deep, and her husband was willing to do the work, and that restored. In another case, that woman walked away from that relationship and became more healthy. So that the two cases I'm thinking of were in relationships that weren't great for them. And one choice is to go deep with your partner and say, "Will you do this work with me? Or I'm going to do it, and you're either coming along or not." And and that works too, because as you transform the people around you. And the second was someone walking away from something unhealthy that they never thought they'd walk away from, but it turned out being the best thing for their health as well.
Mm,
I love that. Thank you.
yeah. And I'd love just briefly, Dr. Jill, for everyone listening, because I know I'm curious, what do you do to get it more in touch with that intuition or to manage stress? What is your daily routine?
Yeah. So a couple things. First of all, I used to get up at crack of dawn, 5 a.m. and go do high intensity interval training and all that. And right around the time of my divorce, I shifted, and I've been much more gentle and kind to myself because that was actually raising my cortisol. I was kind of like beating myself up, like, oh, you got to do this, you got to do this, you got to do this. And I shifted the mentality to being kind to myself. And now my best practice is sitting in my chair in the morning. Sometimes journal, sometimes write. And I've never been someone who meditation works well for, but what I do is lucid dreaming. I go to this beautiful screen in my head and I imagine possibilities and I imagine solutions. So it's a much different practice. It's actually bringing in all kinds of sights and sounds and images. And I'll sometimes even just ask, what's the solution to this problem I'm facing? And I might see images of things and then I let my intuition kind of percolate on those, but it often brings me answers and peace and that. But it's kind of a different type of meditation. It's a much more creative screen. And then I do have a faith practice. I pray, but I don't necessarily have a religious practice. For me, it's I talk to the divine every day, and the divine creative is kind of my muse for answers and solutions. And so I feel very in touch, just moment by moment. I'll often just even have a conversation with the divine in my day to day life, as I need help in the situation, or just gratitude. That's another huge thing. All day long, I'm like, wow. And I find if we frame this as another frame, if we are walking through our day looking for beauty and gratitude, we're going to see it. And those are little like joy bubbles in our life. And those joy bubbles lead to greater happiness and satisfaction. And our bodies and our cells resonate with that.
Mm. You really hit the nail on the head with gratitude because I read this somewhere. I'm sure it's out everywhere, but gratitude or joy can't coexist with fear and all the other negative emotions that we feel. So when you get in that state of gratitude, it just immediately uplifts you. So thank you. Thank you for
One last
sharing.
pro that just came to mind that I think might be the super quick, easy thing for people who are like, I don't know how to do this. One thing that helped me is expansion versus contraction. You walk into a room, you're in a relationship, you're, in a new situation, you're trying to decide on taking a new job or what school to go to. Does that make you feel expansive or does that make you feel constricted? And that's
Mm,
a pretty easy way to differentiate start with your body. And I love it because it's easy. We can all do it. Does this feel expansive or contractive? And usually you can answer and you know which direction to go.
yeah, I love that. Thank you.
Well, I think we're coming up on time. Dr. Jill, thank you so much for being here with us. You've given us practical tips. You've shown how relatable you are. Your work is beautiful and trailblazing. I feel truly so much inspiring material here. We've touched on environmental toxicity, mycotoxins, but the real deep work that you talk about in your book, finding resilience through functional medicine science and faith, absolutely really gets to these deeper root causes that we really need to address. So we generally do 3 rapid fire questions to lighten the mood. I know that you're in a rush. Are you game for those?
Yeah,
Yep.
let's do it. Yeah,
Okay.
absolutely.
Real quick, what does an ideal Sunday look like for you?
Nature, quiet time. I call it piddling. I have no agenda and I just kind of do, and it might be out in nature, might be go for a walk, but no agenda, piddling and nature.
Okay, the unexpected can bring beautiful things.
Yeah.
Absolutely. All right, and then if you could dine with one celebrity or historic figure, alive or dead, who would it be?
That's a tough one. Um, Maybe Albert Einstein,
Ooh,
because he taught me that curiosity is the mark of genius.
Oh,
lovely.
I love it. Awesome. One last question, Dr. Jill. If you're stranded on a desert island, what 3 things would you bring with you?
Oh, I would have said a book, but nowadays if we have like phone with an unending battery with my audio books, that I could
Yeah.
have like 20 books. So the reading, um, oh, that's tough. I think books would do it. So maybe
Yeah.
3
So
books.
3 really good books.
Yeah.
Awesome, awesome. Well, we cannot thank you enough for your time today. Your vulnerability with your work, your expertise, it continues to wow me. Let the listeners know where they can find the book, your new book, Unexpected, and where to find more on you as far as social or your website.
Thank you. And thank you guys. And thank you for letting me go so deep. It was so fun to be with you, and you created such a beautiful space for me to be so real. You can find all of my blogs and podcasts and everything at jillcarnahan.com. Book is also there, but there's a special site, readunexpected.com, where you can get some free bonuses if you buy the book, which is a mass cell lecture, free a secret audio chapter, and a coloring journal, which is so fun because coloring really helped me in my journey. And then be sure and follow me on Instagram at Dr. Jill Carnahan. Lots of fun and silliness there.
Thank you again, Dr. Jill.
You're welcome. Thank you both.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.